At Team Brief this month, we talked about a number of subjects. First, we talked about reducing variation and the Getting It Right First Time programme. And we then went on to winter planning and talked about some of the excellent work we've already done, but also how we're getting ready for winter. And finally, we talked about the new Learning from Deaths programme and asked people's advice on how we can embed the learning within the organisation. And the feedback was fantastic from the teams that were present. I would like to just do one final reminder. We need to keep ourselves well and we need to keep our patients safe. And one of the things that will help with this is the flu vaccine. We know that the flu is a virulent strain which is coming from the Southern Hemisphere, and we also know that the flu vaccine is effective against this. So I would like to encourage everyone to get vaccinated, keep themselves safe and keep our patients safe. Thank you very much.
Hi, I'm James Thomas, and today at Team Brief I presented on the Trust GIRFT programme. The Getting It Right First Time programme looks at variation of quality and outcomes across hospitals in the UK. By doing this, we can improve the quality of care our patients receive and at the same time reduce costs. So nationally, GIRFT identified that there were significant opportunities to improve the standardisation of care and quality that patient receives. By doing this across the NHS, not only is there an opportunity to improve outcomes for patients and improve the care that they receive, but also significantly reduce the cost that the NHS incurs from treating patients in different ways. An example of this is standardising the length of stay after certain procedures, or reducing mortality, morbidity and infection rates, for example. At Ashford and St Peter's, we've had visits in orthopaedics, urology, vascular surgery, gynae, ophthalmology and soon ENT. For all of these visits, we've had a lot of good things identified, but also some opportunities where we can learn from other trusts across the country. As we go forward, we hope that we'll become a hospital that other hospitals can come and learn from, and learn how we have been on our GIRFT journey and what we've done to improve things for our patients. Currently, we're establishing a small GIRFT team in the hospital, which is led by Lorraine Knight, with contributions from myself and David Fluck, the Medical Director, and others. If you'd like more information on the programmes, please feel free to come to any one of us and we can help you get started within your areas.
Hi, I'm Tom Smurden, Director of Operations for Unplanned Care, and I've just given a short update on winter planning and how we're doing as a hospital at the moment. The first thing is just to say thank you to everybody who's been involved in all the winter planning work that we've done. The work will continue over the next 3 weeks as we head towards Christmas, so please look out for those messages in the briefings that we send out, and we will be organising some events and exercises to ensure that we are able to get patients back home as they need to over the next few weeks. So please participate in those as you're required to. We've had a busy few weeks in the hospitals. As you will no doubt have seen, we've had infection outbreaks across the wards. Our paediatric team have been under a lot of pressure this week and last, and I think it's important that we all understand where the pressures are in the hospital and which of our teams are facing particular challenges. But thank you to everybody who was involved in managing the infection outbreak, and of course because we're a hospital, no doubt we will face the same challenges over the next few months. So please look out for the messages and follow the instructions that you're given. Finally, I'd like to just remind everybody of the important notion of patient time. You'll have seen Suzanne's message last week and the video that came out with that. We really want to make sure that we are not keeping patients any longer than they need to be kept in the hospital, and that we can get them back home into comfortable surroundings and with their loved ones. That's the best place for everybody. And it's really important as part of that that we are doing everything we can to follow the principles of the Safer Bundle. And there's been lots of effort this week in terms of making patient days green rather than red out there on the wards, and it really has put us in a good position going into this weekend. So I really urge you to continue with that work. Make sure that we're generating discharges early in the day rather than late, so that there's capacity to admit patients who need to come into our beds via A&E. And finally, please don't forget to get your flu vaccination if you haven't already, to do your bit to keep our patients safe, and enjoy your Christmas.
I'm Erica Heppelston, Associate Director of Quality, and today I've been presenting the Learning from Deaths program, which has recently been introduced nationally, that we're now rolling out in this trust in order to learn more and look into patients' deaths where perhaps this might not have been expected. What this really means in practice is that we need to look at all of our patient deaths in a new way. We need to look at whether there's themes that we can take on board from patient care in all parts of their pathway, whether there is multidisciplinary learning that we can take on board, and what sort of things might be sort of common improvements that we can look for in a number of our patients, and that we can share these messages really widely among everybody in the trust so that it can really come to the top of our agendas. A key part of this new program is what's called structured judgment reviews. What this means is that for the first time really, we have a national methodology which is telling us the kind of things we should look for when we look at a patient's death, when we go through their case files, so that we can be more systematic in looking for the opportunities for improvement and for also the things that have gone right in their care. So if you'd like to get involved with this program going forward, if you could email or phone Mark Hinchcliffe from the Project Management Office, Dr. Melanie Irvin-Sellers, Divisional Director for Medicine and Emergency Services, Russell Vernham, Deputy Chief Nurse, or me, I'm Erica Heppelston, the Associate Director of Quality. Thank you so much, everybody, for listening to this presentation. I'd be delighted for any of you to get involved. Thank you. We've also in this team brief session had an interactive part at the end of it where everyone present came forward with their ideas on how we might be able to share the learning in a really different sort of a way. And some of the ideas people came up with were really innovative. One of them was doing the learning in a manner akin to a Schwartz round so that we can consider staff feelings and the sort of emotions staff have had about a patient death, as well as the family's emotions. And another colleague came up with the great idea of putting learning from a death right as an agenda point on every team meeting that we have, so that we spend just a couple of minutes reflecting on the messages that we've taken forward from a particular patient or group of patients' deaths. And I think that would be a really powerful thing to do, because just to stop for that moment and think about someone's death is really a very meaningful way of taking forward learning.